Welcome to Dr. Balga's podcast for the Curious Doc. Today is March 25th, 2026. This video is on a terrific JAMA review published online 2 days ago, March 23rd, 2026, titled Diagnosis and Management of Resistant Hypertension. Senior author is Dr. Ajay Kirtane. What is resistant hypertension? It's a blood pressure equal to or greater than 130/80 on 3 or more drugs. What drugs are required? An ACE or an ARB, calcium channel blocker, and thiazides. What is apparent resistant hypertension? This is unconfirmed elevated blood pressure. What is true resistant hypertension? Confirmed after exclusions. Prevalence 19.7% for apparent and around 10% for true, both double digits. White coat hypertension, where the blood pressure is high in the office and normal at home. Frequency, about the 37.5% of the apparent resistant hypertension. Non-adherence rate, up to 50%. Secondary hypertension prevalence, about 25% in resistant hypertension. Most common cause, primary aldosteronism. What are the risk factors for resistant hypertension? CKD, diabetes, and obesity. What's the association with obstructive sleep apnea? The odds ratio is about 2.84. What about alcohol? Dose-dependent increase in blood pressure. The more you drink, higher the blood pressure. Age effect, increased risk with age. Gender differences, slight male predominance. What is the pathophysiology? Neurohormonal dysregulation. Key pathways, aldosterone, endothelin, and the sympathetic nervous system. Volume overload role, that's a central mechanism. Sodium intake effect reduces drug efficacy. So you have more salt, the drugs are less efficacious. Potassium deficiency increases vascular tone. How do you measure blood pressure in the office? The patient should be seated for at least 5 minutes at rest. Measurement approach, 2 or more readings on an average. Home blood pressure protocol, twice daily for about a week. Ambulatory blood pressure monitoring frequency, every 15 to 30-minute intervals. The threshold is equal to or greater than 125/75 millimeters of mercury. What's the lifestyle sodium goal? Less than 1500 milligrams per day. Wow, that's really low salt food. Exercise recommendation, equal to or greater than 150 minutes per week. Weight loss effect, for every 1 millimeter, there's a 1 millimeter decrease in blood pressure with a kilo of weight loss. That's 2.2 pounds. Reducing alcohol decreases systolic blood pressure by 5.5 millimeters of mercury. What about treatment of obstructive sleep apnea? CPAP lowers blood pressure. What's first-line therapy? ACE, ARBs, calcium channel blockers, and a diuretic. The preferred diuretic is chlorothalidone. Combination pills benefit, so-called polypill. The systolic blood pressure decreases by 4 millimeters of mercury. The next drug, spironolactone. Spironolactone decreases systolic blood pressure by double digits, 13 millimeters of mercury. Spironolactone risks hyperkalemia and gynecomastia. Alternative mineralocorticoid receptor antagonist, eplerenone. The benefit is less hormonal effects. What about the role of amiloride? That's an alternative to MRA. Other drugs, beta blockers and clonidine. I prefer carvedilol, it's both an alpha and a beta blocker. What about aprocitentan mechanism? It's an endothelin blocker. Decreases systolic blood pressure by about 4 millimeters of mercury. There's a risk of fluid retention. It interacts with NSAIDs and SNRIs. Medication review is the essential step. What about renal denervation? It's a catheter-based therapy, decreases sympathetic activity. The effect size is about 4 to 6 millimeters of mercury, and the responder rate is 2 out of 3 patients. Eligibility when the eGFR is equal to or greater than 40, and there is a suitable anatomy for denervation. Prognosis, The increased cardiovascular mortality risk. Absolute risk increases by about 10.3%. All cause mortality increases by increased risk. The key strategy, therefore, is blood pressure reduction. The outcome is decreased events with blood pressure drop. This is a terrific review. This video is in a nutshell. Go ahead to JAMA and read it. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.